I'm one of the emergency specialists at the Royal Hobart Hospital, and when I started doing the leading course, it was because I was coming from a place as a director of emergency medicine training. So my role at that time was to take doctors who were training to become emergency specialists and helping them develop the skills to be able to be more than competent, in my view. I want them to be the best emergency specialists that they can possibly be. The Leading and Managing course came along at exactly the right time for me. It was completely and utterly not what I expected it to be. And I'm incredibly grateful that it wasn't what I expected. The material from really early on in the course, incredibly useful for our very complex environment that we work in, where we lack control. So 10 ambulances arrive in 1 hour and 20 patients walk in the front door. We don't have enough staff, we don't have enough space. It's a very overwhelming feeling, particularly if there are other things that are going on that are outside of our control. Emergency departments, we have very little control over what's coming in and what's going out. And it can be an incredibly stressful environment in which to work. What I learnt in the early part of the course was about how I can inoculate myself with resilience, how I can inoculate others with resilience, how I can choose to bring an attitude to work with me that infects the entire team, that allows us, in spite of overwhelming feelings, to have a great time at work, to be happy. And one of the things that always makes a difference with is productivity and patient outcomes. If you've got happy staff, they're going to be far more productive. If you've got happy staff, they're going to make patients happier, and patients are going to have a much better response to the treatment that we're offering in terms of healing time, in terms of satisfaction, and in terms of ability to go home and to communicate what's happened to them and what's gone on with other people, their loved ones. And that is so important in terms of recovery and healing. I've more importantly, or just as importantly, learnt a lot about myself and about how to manage and coach myself so that I can better manage and coach other people, so that on a day-to-day basis, not just a career view, but on a daily basis, they can bring their best selves to work, they can bring their best selves to their personal life. By going back to the online content, I was able to replicate that experience and get that learning, and spaced repetition is so important for actually absorbing education, absorbing learning. So I found the online content really useful to support what happens at the face-to-face workshops. I have found this incredibly worthwhile. It's given me confidence in my ability to help other people be the best that they can be. It has given me the confidence to be the best that I can be, and how I can always bring my best self to work or to a problem. Some of the skills that I learnt at Leading and Managing, I've been able to use in my life outside of work, that has really enhanced my life for better. It is really important that other people get the opportunity to learn from this course. I have found that my leadership is definitely better, my management of people is better, and ultimately the management of myself is better. This is having an excellent effect on my young family. It's having a great effect on my career, and it certainly has a brilliant effect in the workplace.